Just want to say hello, everybody. My name is Rob Fisher, Executive Director of Strikers. On the call, we've got Steve McManus, who's one of our other Executive Directors. And most of you know Coach Jordan, who's our goalkeeper coach, and his brother, Dr. John Sanguedolce, he's in New York. So we've had a couple of calls with John over the last couple of weeks. So we're very privileged to have John on the call. So John's going to go through quite a few things just about what's been going on with the pandemic and what he's dealing with in New York. So I'll pass you over to Coach Jordan, who will do a little introduction, and then we'll get going with John talking to everybody. Over to you, Jordan.
Awesome. Thanks, Rob. Hello. For those of you that don't know me, I am Jordan Sanguedolce. I'm in charge of all goalkeepers at Strikers, and I'm the strength and conditioning coach too at Strikers. First of all, I hope all of you are healthy and safe in this crazy times. I'm honored to have my brother here that has taken time out of his day where he is saving lives in New York, where it is absolutely crazy, as you all know about this virus. It's, like I said, in New York, it is the epicenter, and I am pleased to introduce Dr. Sanguedolce.
Without the mutes, you can't hear the round of applause, but I'll just assume there's a round of applause from everybody. Thanks for the introduction, Jordan. Means a lot more with that mustache. Appreciate it. But for those of you who don't know me, this is our, I think, 4th or 5th talk that I've done, spoken to some local high schools. And I start off as Rob and Steve asking me to speak to, soccer parents, soccer players, why we're doing these precautions that we are doing. And it's, I just want to thank them for having me repeatedly and, hoping to spread the message. My goal in these talks is to not see my hometown that, I grew up in and I'm very proud to be a part of. I went to El Dorado High School. I grew up in Orange County myself, to see what's occurring in my community here in New York, avoiding that from occurring where I grew up. So I just, would hope that some people learn a couple of things and can be a little more educated onto what exactly is going on. I'd like to also preface by saying, I won't be giving opinions. I won't be giving things that I can't, state scientifically. I will give you my experiences, but my experiences have been 6-7 straight weeks of working in the emergency room. So I don't have all of the research that some of you may need to answer some of your questions. So I apologize for that. So starting off, I work, I'm the chief resident in the emergency room at Stony Brook Southampton Hospital. My job when people come into the hospital is to decide whether or not that person should go home, whether or not that person should be admitted to the medical floors, or whether or not that person needs to be intubated. So as you can imagine that, everyone comes through that door. I have had hundreds and hundreds of people that I've had experiences, so I'll speak to my experience with that. This virus, to put it in layman's terms, is not comparable to anything that we've ever seen. Maybe the Spanish flu in 1920 was something that wiped out 20 million people, and that could possibly, in comparison to this, that's what doing that stuff without social distancing and the precautionary measures that we're doing. Right now, our hospital is a 125-bed hospital. We have mandated by the state of New York to double our available beds, and we are well over 250 to 300 patients admitted to our hospital right now. And in those 300 patients, we have a 7-bed intensive care unit, what we call the ICU. And our intensive care unit has now almost 8 times the amount now. We have about 50 intensive care unit patients. That means that all these people are on a ventilator to live. And when I say ventilator, that means somebody who's intubated and they have a tube down their throat and they're put into a medical coma and they're breathing via a machine. The youngest person that we've had is 29 years old without any other what we call comorbidities or any other conditions. The second youngest being 33, and the list goes on and on to our elderly. We have had, of those 40 to 50 patients who have required intubation, and mind you, that's the tube inside of you, there's only been 9 successful people who have left my hospital who have gone on to say that they survived the severe form of this disease. What I'd like to educate you guys on is really what we can do to prevent this. So there's been studies now that up to 40 to 45% of people, if you were to go ahead and just swab routine people, that you could catch up to 40% of people have this without symptoms. So what's scary about this is that people who have symptoms are usually the fortunate ones in preventing it from spreading it to loved ones. So as I'm talking to, a club soccer team, if I'm a 16-year-old eager to get outside and play soccer, you may say, I don't have a cough, I don't have a sore throat, fever, I'm going to continue to go out and play. Well, going out and playing means that you could have it, you could get it from people, and you could be the reason you come home and you kiss your mom or your grandma, and you could be the reason that you never see your mom or your grandma again. What's terrible about this virus is that families aren't allowed to be in the hospital with loved ones, and people daily are dying alone, and they're dying in medically induced comas, and it's tough to see. It's tough to witness. It's scarring. It's tough for people to not understand that when their 40-year-old dad goes in the hospital, all he has is a fever and cough, that 2 days later you're having the conversations of, are you interested in keeping him alive via the machine? So some of the things that I'd like for you guys to know moving forward, I'd like to talk about some of the symptoms, some of the things to look forward to. We've seen that, only people, so there's a group of people with symptoms, there's a group of people without symptoms. Again, the people without symptoms are the ones that can be the silent killers and spreaders in this. The people with symptoms, we're seeing that day 4, day 5, people, about 80 to 90% of those people with symptoms will develop a fever. So again, that leaves 10 to 20% of people without a fever who think, oh, I can still go to work, I can still do this, I can still do that. A lot of people now are starting to present for the first day or two, sore throat, weakness, kind of muscle aches and pains. And they're starting to see that, 4 or 5 days in, that they're developing the fever. The cough usually comes after, a dry cough. It is not a pneumonia cough. If anyone's ever had pneumonia where you're spitting up a lot of sputum, it's most of the time we're seeing that it's a dry cough. And really, day 7 to 10 is really the time that this virus gets into your lungs and is absolutely wiping people's health out, to put it in layman's terms. Some people are just not fortunate enough that it doesn't get to the lungs, but this virus lives in the back of your throat, and people who have luckily clear this, can walk out, and there's a lot of mild cases, but we're seeing that there's what we call a cytokine storm, and cytokines are inflammatory markers in the body. And what's going on is these people at 8 to 10th day, they look fine, they seem stable, they may need some oxygen, and that cytokine storm occurs. And when I mean cytokine storm, it's essentially a grenade inside your body. And some people are fortunate that the pin comes off, and some people that the pin stays on. Some people are unfortunate that it comes off, this storm releases. They get clots, people will get strokes, they'll get embolisms in their heart, they'll have heart attacks, their kidneys will fail, their livers will fail, they'll get meningitis, encephalitis, which are things that go to the brain, and they just simply don't recover from this. Again, these are not all cases, but these are people that I'm speaking to that are 40, 50, sometimes 30-year-old healthy individuals without any risk factors. We're seeing that most of these people are men who are needing intubation. The amount of people being infected is about the same, maybe a little more in men. And again, I'm only speaking to my hospital. I'm not speaking to the national averages or anything like that, because I'm actually not aware of them. But we only have 2 women currently who are intubated. So you can imagine there's only 2 of them versus the men. And mostly, where I'm not seeing this in your typical smoker, your typical lung cancer, those kind of patients. Really, men with high blood sugar, what we call diabetes, and men with high blood pressure, hypertension, are the most at risk for this disease. So we've gone over kind of who's at stake here, kind of gone over the symptoms to look out for. Now I'd like to talk about when should you go see a healthcare provider? Because that seems to be a common question that we get a lot. To defend my people per se in the medical field, we aren't ignoring you. We don't want to give you the best care. We aren't saying by staying home that we're being lazy. It's actually the only thing that we can do. And when I say that is the only thing that we have to treat this virus is the ventilators itself. And the ventilators are basically the machines that work for your lungs. Anything else is supplemental. Oxygen has been shown to help people that don't quite need to be on the ventilator, but we can only provide you with oxygen, and we can only provide you with the ventilator that you can't provide yourself at home. There is no treatment for this virus. There's many different medications that they've tried, and they work fantastic in the lab. They work fantastic in primates. They work fantastic in rats, but it's just not the human body. And anytime that you hear good trials and that there's good associations, but nothing has been shown to be clinically effective to where it is approved that all patients must receive it. So if you are, a 17-year-old and you're home and you have a fever, it's day 3, day 4, you have a fever and you have a cough and your mom says, we're going to the doctors. If you're not short of breath, and when I say short of breath, meaning when you get up to go to the restroom, you feel like you're running a mile. When you just sitting in bed, you're huffing and breathing faster. There's nothing we can do to offer you. So that gentleman would now say, okay, I'm going to go to the doctor. What does he do when he goes to the doctor? He goes to the doctor. He puts everyone at risk in that office. The secretary, the nurse, the physician. He gets a chest x-ray because he's got a cough and the mom demands he gets imaging. Guess what? You got everything you wanted. You now have proven that you have COVID pneumonia. We see the bilateral pneumonia. And congratulations, what are we going to do? We're going to say, go home. These are the signs that we can help you with. So really, the do no harm in this is really what we're aiming for. And that if it's not going to change outcomes, we're hoping that you do stay home and avoid exposing other people. Now, being young and athletic and healthy, I recommend you go outside and you do individual exercises and working on your craft, soccer, whatever it may be that you want to work on. But just be careful that the reason why we can't resume sports, we can't resume many things is because there's been studies now that the 6 feet rule is basically a way of the government, or maybe not the government, the way of society to say stay apart from each other. And there's this 6 feet. 6 feet isn't a scientifically proven measure. It may, I bet you if everyone was 1 foot versus 6 foot, you'd find better outcomes. But as far as standing 6 feet from someone does not ensure that you can infect them. And what I mean that is this virus is only infected by getting into your mucous membranes. Mucous membranes consist of your mouth, your nose, your eyes. From there, that virus can live in the back of your throat and cause the damage that I already discussed. The virus can be on your skin. You can touch things. You can feel things that have virus on it. But if I wash my hands and that soap binds to the virus, washes away, now I'm okay to have dinner with my family and put food in my mouth without transmitting that virus into my mouth. So the 6 feet rule, what I wanted to piggyback on was, as it pertains to athletes, if I am running in a straight line and someone is running behind me, because I'm breathing hard, and by breathing hard, I'm putting these droplets into the air. Droplets, I speak, there's droplets microscopic level that hang out in the air. And when they're in the air, if I were to breathe those in, it could be fatal for me. If those droplets fall to the ground, they can't harm me because I'm not ingesting them. They have already fallen to the ground. So somebody who's riding a bike at 16 miles per hour would have to be over 65 feet behind me in order to not ride their bike into my particles. So that means that broke it down also that if I was to run at a pace of a 7-minute mile, which isn't relatively too fast, it's more of for you athletes, it's more, basically you guys are probably doing 6-minute miles in practice or whatever. Nonetheless, I would need to be over 32 feet away. So even something as little as you and 2 friends training together can put you all at risk. So that's really the things that, we should be mindful of. We talked about how the virus can get into your system. We talked about, basically hand washing. I know it's very cliche. Hand washing, hand sanitizer, really is what's going to prevent you from putting this virus into your mouth if you're not around others. Anything with 70% or greater alcohol content on a sanitizer is more than sufficient in killing this virus. And washing your hands with soap and water for 20 seconds binds the virus, because viruses are what we call lipophilic. So they like them, they bind, and you wash them off. As far as preventative measures going into the public, masks are a big topic of conversation. Right here I have a surgical mask. This is the paper thin mask that we find most people have when they do go out if they don't have a cloth mask. These masks are necessary for you to prevent spread to other people. So if I put this on, my droplets are being contained in this mask, okay? But it is not protecting myself because this is not a fitted mask. I put it on, I have room on the sides, I have room underneath, so that way if I'm hanging out with my brother and I have a mask on, I'm protecting myself from infecting him. But his droplets can get into this mask and cause me harm. As far as other masks that are used, this is what us healthcare professionals use. This is an N95, and it's hard. I'm sure it's hard for a lot of you to get your hands on these, but these are proven that these are, if you don't have a beard, it attaches to the face, and we are all as healthcare providers fitted for these. And this is saying that it's called an N95, meaning that 95% certainty that exposed droplets in front of you will not get in your mask. So for those who have or are fortunate to have an N95, if you are going to a grocery store, if you are going to Costco, if you are going to a place where you have to go to and you are at risk, the post office, whatever it may be, if you have an N95, I recommend you wear that and you put a surgical mask over it. Because if I put the N95 with a surgical mask, this is protecting this. And what I can do is I can discard this, and I could keep this in a brown bag and reuse it some other time. So using these, as long as they're not soiled, you can reuse them, put them in a brown bag, and save them for another time, as long as you're protecting with another mask. With that being said, I've heard a lot of different theories that people spraying them with Lysol or washing these masks. Now, cloth masks can be as effective as this, and you could wash them as you choose. N95s, once they're soiled, they become more porous, and these particles will get through this. So spraying this with Lysol is actually contraindicated per se. So those are the kind of things you don't want to do. But having an array of masks that you choose to use and putting them in plastic bags would more than suffice for that. In the past, Steve's always hit me with some tough questions as far as surfaces, and I've tired of being embarrassed in front of everyone, so I looked into it, and I found a Harvard study now that shows that it compared SARS-CoV. SARS-CoV is the first coronavirus that came about in China, I believe in 2012. It was known to kill about 8,000 people. And versus SARS-CoV-2, which is what we're seeing right now. This is a virus that starts in bats. And it's, the wet market in China was the cause of this, as you guys have heard. But the coronavirus itself is a family of viruses that does account for 20% of the common cold. So the coronavirus is nothing new. It is a simple, everyone in this chat has gotten the coronavirus yearly, if not yearly, at one point in their life. And within that family, there's tons of different strands. We just have never seen the SARS-CoV-2, as known as the COVID-19 strand. But basically what they did is compare the COVID-19 versus the other one that was in 2012. And its virulence, meaning how strong the virus is, has been substantially greater than the other one. So, one of Steve's questions a lot of times was male. This virus has shown to live up to 24 hours on cardboard. So packages coming to your house, I recommend opening packages outside of your home, discarding the cardboard, and coming into your house and washing your hands for 30 seconds with soap and water immediately. Now, when I say that it lives on cardboard, we don't know enough to say, is that enough that can harm you, or is they're just particles? So basically, but it has shown that it can live up to 24 hours. Plastic has been shown up to 36 hours. So I advise anyone who's going to the grocery store and they come back with goods, to wipe down plastics and metals, because metals is the absolute worst for this. And they're showing that up to 72 hours, this virus can live on metals. So your doorknobs, your keys, anything that you touch every day, that can be shown to 72 hours. Now, what's important to this to know is this virus is all around you. You can't always obsess over, am I exposed, am I not? Because what you can control is how much time you need to be outside. You can control, I absolutely need to be here. And if I am here, I'm going to wear a mask. I can control how much I bring into my own home. It can live on the bottom of shoes, taking your shoes off when you walk into the house, opening your mail outside, wiping down your groceries before bringing them onto your kitchen counter. All these things are effective ways of limiting your home's exposure. But really, the more I touch things, the more accumulates on my hands. So if I have allergies, now is not the time to skip on medication and start scratching your eyes. Now is not the time to not wash your hands before you eat. Now is not the time to pick your nose because it's a habit or whatever it may be. So always know that as long as that virus you're not bringing to your face, you can protect yourself. So make sure you wash your hands. Basically, all this epidemiology studies and everything, all it comes down to is avoiding people when needed and washing your hands. Now to the point of how can we get back to society as we know it? How can we get to the point where people feel comfortable that they can put their kids onto a soccer field or go back to school and not be spreading it amongst each other? They're doing a lot of now of antibody testing that is in its preliminary stages. And that shows that if I have been infected, I build antibodies in the blood that says, hey, we've seen this before, we are now immune to it. And it's great in theory, and it's very effective for measles, for mumps, rubella, all those things that we need to get titers for at 12 years old, 15 years old, 18 years old for our pre-sports physicals. The tests itself are not specific to SARS-CoV-2. They have not found a test that can only pick up COVID-19. A lot of people are showing immunity via the antibody blood test, but it is not because they've been exposed to this. It may be because they contracted the coronavirus, some other time in their life that was not COVID-19. So until those tests come out as, more definitive that it is in fact you have antibodies, we're just not where we need to be currently. So look for antibody testing to be something that's very important for us getting back to our real lives. Because if I can say that I have 20 kids on my soccer team, that if all 20 of them go to the doctor and get labs drawn that they do have the antibodies, then they can resume play. The issue with that is we don't know the levels needed built up in the blood to say that you are in fact immune. For instance, if you come to me as a 15-year-old and the school says you need a measles, mumps, rubella shot, I will draw the blood and check your titers to see how much is actually viral in your blood. And if you have, for instance, over 15, a viral load of over 15 of measles, then I say, guess what? You don't need a shot. You are immune. 14, less than 15, I can say it's not enough. This is tried and true that this is not enough immunity, and I would give you that vaccine. So we're not at any point in science where we can definitively say you need to be at a level of 100 versus a level of an 80. We're not at any point where we know definitively that this is this only strand of coronavirus and that a flu cannot cause you to positive tests as well. Our testing right now is about 70 to 80% effective. I have many people who have passed in my hospital who have had very severe cases, and we've tested them 3 separate occasions and all have come back negative. And they have every single aspect of this virus. So until a test, says 100% that this is effective, it is tough. It is tough to quantify. In my opinion, I think we are vastly underestimating the severity of this virus as far as mortality. In New York, we're considered the epicenter, but we have 200 to 300 people a day who are dying of sudden cardiac death or arrest, and we don't know the cause of death. And in the past, before the coronavirus started as a pandemic, there was about 15 to 20 unreported causes of death a day in people's homes in all of New York City. And now that number is up to 200 or 300. And we are not testing people who have had fatalities. So we are assuming that they are not people who have died from this virus, which just is not the case. So I'm sure there's many other things that people want to touch base on. I have, lots more to share. I welcome any of your questions. I know the coaches usually have a good list of questions that kind of encompass the most common. So I'll leave it up to them to start asking, and we'll go on tangents from there.
Johnny, fantastic stuff. You're absolutely killing me there, because you basically just ruined all my questions. You literally answered every single question that I had.
Radio.
I'm going to go to my go-to ones, and then we'll just branch out from there. I'm sure Rob and Jordan have some, and then we can open it up to the parents after as well. I had to leave in and out a few times, so if you already answered it, I apologize. The negative positive test. I hear that people are getting tested through the nose. It's coming out negative, but then they're getting retested and they're positive. What are you hearing about that?
Yeah, so it's you can test people, and again, it's only 70% sensitive, this test right now that we currently have. It has advanced to the point where initially we're sending our tests to the Department of Health, and it was taking 7 to 10 days to get results. We're at a point now where we're getting results in 2 hours, which is great. With that being said, this test, when you test for it, in my professional opinion, I don't believe people are swabbing people correctly in order to get a positive. For instance, it is very, very uncomfortable, this exam. So people like to use a swab where they go up the nose and into the sinuses. If I have it, it's not going to my what we call nasopharyngeal, which is the back of my throat. There have oral swabs now. I don't know the sensitivity values on that. But those, if I were to go into the mouth, is not as effective as what we call nasopharyngeal. So that's into the nose and to the back. So I go up and all the way. And it basically, that stick has to go about this far into your nose. And that stick this far into your nose for 10 seconds of twirling. And is very uncomfortable. And, people just by nature don't want to cause harm to others. So they're basically just putting in their nose like 1 second, boom, pulling it out and sending it to the labs. But really, you have to be very invasive in obtaining it. So we're hoping that, people are more educated in getting those, and we just need more specific tests in the future. But, those tests can be done in the laboratory. They're very expensive, but the quick things that we could just like a snapshot are not as great as the other ones for now. Thank you.
I think you've done a pretty good job there of making sure people don't want to go and get tested for it anymore, because the thought of having that something shoved up your nose is pretty scary. So thanks for that, Johnny. A quick one then. We'll wait for them to jump on. Are pregnant women or anyone with any underlying conditions or anything at a greater risk? Is it based on immune system? What's the situation with that? So
what I've noticed is really men with high blood pressure and diabetes, coronary artery disease, which is clogged vessels, are at the most at risk. The CDC has the same recommendations for pregnant women than they do all others. We have several pregnant women working in the hospital now who feel comfortable and have not had any issues. So pregnant women, there has not been shown that it's a vertical transmission, that like HIV, that if you have coronavirus, that when you have a baby, that they will have coronavirus as well. But again, this is a novel new virus, and we can't confirm that until more studies come. But I will say, if as a pregnant woman has just as much risk as anybody else, and it's not something that you should fear that if you were to get it, it could be something that your baby is born with congenital diseases. But these are the things that we can't confirm for now. But the CDC recommends pregnant women as average risk for others. And as far as people with underlying conditions, from my experience, it's the diabetic, high blood pressure, people with poor heart function that really have had a struggle with this disease. I've seen somebody with leukemia walk out of my hospital, and then you can't explain why a 36-year-old gentleman who works out 5 days a week doesn't walk out of the hospital. So it's very tough that there's different loads to this virus, and you just hope that by taking the precautionary measures, you're not getting, the most virulent form of this virus.
I know, because there's a question been typed in here, because I know that you said earlier you don't want to say anything that you're not sure about, you just want to talk about your experiences. So you might not know the exact statistics and everything on this, but the question here is, Sweden is taking an opposite approach. Other countries are starting to open up. How long is it going to be before you see the US taking a similar approach? I know you're dealing with the day-to-day stuff, but have you heard anything about that?
That I don't know. I know we've extended in New York I believe to May 15th. I personally believe that there's going to be a large spike of this virus once things are resumed back, just because people are going to be more excited to do things in crowded areas. For instance, they've done studies where people who live together. I've had multiple families who have come to my care, and I've admitted and intubated and put them in the intensive care unit, and have passed alongside each other. Mothers and daughters, mothers and sons, and brothers and sisters, because they're living in the same environment. So, people going to a bar or restaurant or hanging out and yelling or playing sports, a lot of things can go into the air, and for long periods of time, it puts you at great risk. So, I know it's tough from a standpoint of we all want to get back to our everyday life, but for now, we got to ride this out, and we just hope that we can get to the point where everyone can get tested or get antibody tested, so we can resume our normal lives as they were, and know that this person is at risk and they should stay home another 2 weeks or whatever it may be. But I can only speak to my hospital. It has not let up. We just keep filling more and more people, and unfortunately, we are anticipating another wave once these bans are lifted.
Thank you.
Yeah. Johnny, with the government coming out with, all the different phases from phase 1 to phase 3, obviously it's different from state to state. In your opinion, what do you think would happen if the lockdown was removed too soon and all the states came back, when we don't really think that it would be a good idea? Because I know right now we had huge protests in Huntington Beach the other day, and I know there's many states that are protesting about wanting to get back to normal. So what's your opinion on that?
My opinion is I can only speak to what I've experienced. Unfortunately, I've gotten accustomed to fatality with this, and I've witnessed a lot of things that make you scratch your head and wonder, like how fortunate we are to be healthy. So you never want to see someone be the reason that their loved one dies. And unfortunately, by coming back too soon, that's what we're putting ourselves at risk for. And you don't want to be the reason that, you kiss your mother and your mother's 50 years old and healthy, and she's, next thing you know, fighting for her life without her family by her side. So my perspective is more from what I've seen as tragedy. So, I'm on the opposite side of the fence. I also understand that people have everyday lives and that their, careers are being altered. But just know that we as healthcare workers want this to continue as long as we need, so that we can, go back to our lives as well, as far as making sure that, we have the resources. What people don't understand is last week there was a 3-day stretch in Long Island, where I live, where there was no cardiac catheterizations performed in all of Long Island. That means that there was not one heart attack that was intervened and blocked arteries open. That's because people are not seeking out healthcare. So this is going to have a lasting effect in the future, where somebody with a bad heart who now has not had a preliminary consultation with his cardiologist for 6 months could die younger from a congestive heart failure problem or from heart attack because he went 6 months without medical care. Same way people with screening for prostate cancer, screening for colon cancer. If you don't go to your doctor, you can't be screened for those things. And you may, by the time you get an appointment, whenever this resumes or whenever we can get back to reality, you may have a more aggressive form of cancer. So it's not just the virus itself that we're protecting. We want this to be as fast as possible, but also when we resume life, we don't want to go back to square one. So just know that, everyone's got to do their part, regardless. And just, you got to listen to the specialists, and until they feel that the human life is not going to be put at risk for you going back to work, then, that's what we're going to do, because it's different. It's different when it hits home. So that's what my message would be to people who are eager, because you don't get to be by the side of your husband or your wife. You're at home waiting for a doctor to call you at the end of his shift at 9 o'clock at night. And for 20 straight days, he's going to tell you nothing's changed.
Yeah, definitely. And I think that's the thing, across the country, it's definitely going to be, depending on what state that you live in, that will, hopefully get back to some type of normality. We have one question. We've heard all about the lack of supplies. Is there any way we can help to donate in order to fix that problem? I know you can talk a little bit later about the GoFundMe page we've got set up for you, but is there any way that families can help with the lack of supplies and stuff like that?
Yeah, we've had, we set up for these talks, we set up a GoFundMe that people can donate money that goes to residents, nurses. For instance, we've been getting bagels and coffee in the morning, and that may be the only meal people eat all day. We have been able to purchase N95 masks, so that way I can go, if I go into a patient's room that is spreading the virus everywhere, I touch 10, 15 patients a day that are sick and coughing, and I'm in my suit. Sometimes it's nice to be able to take my mask off and get a fresh one, but really, as medical providers, we're only allowed one mask a day. So, we're trying to find different means of obtaining more masks, obtaining more PPEs, which is the gowns, obtaining more screens for the eyes. So my hospital has done as best they can to provide me those things, but it's within a limited capacity. So, anytime you guys can send donations or whatever that may be to healthcare providers, you would hope it would go to good use.
Okay. Yeah, I think I actually saw a picture today, of the people that are wearing the masks all day with bruises around their eyes and marks everywhere, basically from having to wear the same mask, basically for the long shifts they do throughout the course of the day as well. So if we can help in that sense, that'd be fantastic. A couple of questions that we've got here on the chat, Johnny. First one, very straightforward one. Is it affecting small children, young children? And if so, to what degree?
Yeah, so young children are not showing symptoms. They are able to get this virus just as much as anybody else, but they're not showing as many symptoms. So that's the issue is, you may have a child walking around and, your 3-year-old is not going to cover his mouth when he sneezes. Your 3-year-old is, going to just terrorize the house, I'm assuming, as much as he normally would, but he could be spreading the disease. I believe yesterday was the first day that there's been a reported case of a 5-year-old who lost her life, who was a daughter of 2 healthcare professionals who brought it home, and it traveled to her brain and she passed away. But that's our only one so far of young children, but they can get the virus and they don't exhibit as many symptoms. But just know that, right now is RSV season, croup season. Kids do get allergies, kids get sniffles, kids get a myriad of things. The flu is still prevalent. Not everything is this virus, but just be more mindful that if you do see that your young one does have symptoms, then just keep them away from people that they can harm. Would be my best advice.
Another question. And then obviously you stated at the start about expertise and knowledge, but based on your experience you've got, how long do you think it would take, and I'm not sure you already answered it, to find a cure? You mentioned obviously they're trying to speed it along quicker than normal. What's your...
So a cure is different than being able to help people. There's never been a cure for a virus ever. And, we don't have a cure for influenza virus. We don't have a cure for human immunodeficiency virus, which is HIV, but we have medications that have been shown to very much control the symptoms of this virus. So what we need to do is we need to come up with medication that you can get the coronavirus, that there's not going to be a shot that kills the coronavirus, but there can be something that we do that prevents it from causing this such widespread pneumonia, whether that's something that decreases inflammation in the body. And that's where all of our research is aimed at, is preventing the harmful effects of it. But to say that we're going to have a cure for this isn't something that we should be aiming for. We should be aiming for a vaccine, and we should be aiming for known drugs that can cause less progression of this disease. Just to put in perspective, most vaccines take up to 10 years to create. So if we're hoping to create it within 1 year, it'd be a huge advancement in science. So these things do take time, because you need to make sure that this vaccine, when you give it to someone, that every single person, it's not going to kill them, because you can't have a vaccine that's not tried and true with everybody. So vaccines is where we need to get our focus to, and preventing, because the only really things that we can actually control is preventing this disease. That's the only thing you can do as a citizen of this world, is to prevent it, because we can, as healthcare workers, stop it once it occurs.
Okay, appreciate that, Johnny, and makes complete sense. Last one for me from now, and then I'll let Rob and Jordan jump in. Once someone has tested positive and not had a serious reaction, is that an indication that there is an antibody in that person that puts them into a low risk category?
Yeah, it's a good question. So, ideally we want to get the virus and have a very mild form of it and build antibodies that, hey, now when it comes next, my immune system knows what's going on and it can really fight this. That's the ideal world. We don't know enough about how many strains there are of this virus. We don't know enough that this is going to be a seasonal virus. It's going to come back again next year, or if it may ever come back ever again. So, I guess there's a lot of false sense of security in getting these antibody tests, because you don't know to what capacity you've been exposed. But people are safer who have had the virus and have cleared it, because they will have immunity to it. But does not mean that you should be, when somebody sneezes around you, that you shouldn't be covering your mouth or turning the opposite way. So it's novel, the virus, and so is our research. So you would hope that clearing it, you clear it, but also know that it's not a 100%.
All right, thank you, Johnny.
Cheers. We've got a couple more here for you. Johnny, in your opinion, do you think that the COVID-19 virus has been around prior to the start of this year? There's obviously a lot of reports that in California, we probably had it circling around in November, December time. So is that sort of like there's been plenty of cases across the country, hasn't there?
Yeah, so I believe November was the first reported case from China. But really, that's when they started to notice, hey, this is a nasty bilateral pneumonia that isn't responding to antibiotics or oxygen. So, I'm curious that's when they started reporting it. But to say that November was when it first started, I believe is a little premature. And to think that you can't be in California and have a virus in December, January that came, a month or two earlier in China, is also being a little naive the way the world is connected. So yes, I do believe that it has been around longer. And unfortunately for what happened in Washington was such a virulent form of this virus was spread. And I think for Californians, they benefited from that, knowing that their neighbors, it was, hey, this wasn't just an East Coast thing that came from China. It's right in our, right above us. So I think that you guys did a lot of better precautionary measures than other places, which is, kind of like the population to amount of people is lower. So you guys should feel good about that. But I do believe that it was around prior to then the reported cases.
I'll jump onto one of my go-to questions, Johnny. So you'll probably be able to answer this in your sleep. Fast food, delivery food. How safe is it to either go and get some or have it delivered to your house, DoorDash, and all that good stuff?
Yeah, so they're offering delivery food now where they have the drop off at your front door method. So I recommend that to people. If you get Uber Eats or whatever that may be, and they drop it off at your front door, You wait till them to get to your car before getting it. But you always pose a risk when you're not preparing your own food. And even if you are preparing your own food, you're getting it from the grocery store, which can also pose a risk. So we talked about how the cardboard was something that it could live on. So, my recommendation would be that you get your food and you put it on a plate, wash your hands, and you should be okay with the thought that you can't get it off of opening up packages, or you can't get it from buying milk and it not living on the milk carton. So those are things that you can prevent. But I think the best thing for ordering in food is putting it on a plate, washing your hands, discarding the stuff that is kind of open to the world, and you should feel safe with that.
Okay, thank you, bud.
Cheers, Johnny. I think this is one sort of for especially California. As we're sort of heading into the summer months, what sort of the advice that the doctors and yourself would be given to if we're having to stay at home? How do we get to go outdoors and enjoy the hot weather? Because I know already, people are going to be wanting to go to the beach, go surfing. We've obviously seen that some of the beaches in Florida are starting to open up. How do we sort of deal with that? Or is it really we just need to continue to stay indoors and look after ourselves?
Yeah, so the worst thing that we can do is abort something quickly and have the ramifications of that. Whether you believe in the plan or not, it's not. I didn't create the plan, so anyone can have their opinion about it. But we should at least give it a chance to see if we're able to eradicate this, because we have over. Maybe correct me if I'm wrong. There's I think like 97,000 deaths now. I want to say if you count, there's something substantial like that.
You're talking about globally? Sorry to interrupt.
Yeah.
168,000 is what I saw this morning.
Okay, so 168,000 people.
Hi, by the way, cousin. Sorry about that. Sorry to interrupt, man. It's good to see your face. Thank you so much for this. I'm really happy to see you, man.
You too. Thanks. So it shows how much I pay attention to stats. But if we're talking 168,000 people, that's with the world shutting down. That's with the economy shutting down. If life continued on, if I was at Staples Center right now watching the Lakers maybe win a championship, and we all got screwed out of that. I know it's tough, but if I'm watching LeBron and Anthony Davis, and I'm in Staples Center's packed with 18,000 people yelling, if there's 5 people in that place, everyone's going home with this virus. And if you take public transportation, you're going to infect the subways, you're going to infect the buses. So it's tough because we have shut down the world and we're still having these kind of deaths. The subway, there's nobody in the subway in New York City right now, and they've already had 50 workers die from this virus alone in the last month, despite nobody being on the subway. So it's just something you have to do your part in, because you will, if we don't, you will know someone whose life is severely affected by this.
Yeah, thanks for asking that. I think that's the big one. How do we know, if there's going to be a start-up when we can go back to normality?
We're doing 150,000 tests a day in the United States. Harvard's predicting we need up to 20 million tests a day in order to finally get to the bottom of who is infected, who isn't, and when we can resume. So we're just not there yet. Our preparedness is a different discussion for a politician, but I'm only here to say what you can do as an individual.
Here's a question, Johnny, that was asked. So this virus is causing blood clots. How would we know if someone is getting blood clots?
So part of inflammation in the body is our blood system, the way it coagulates, basically the way the blood clots. An inflammatory way that it affects our blood is it does become very what we call hypercoagulable, where the blood does clot. And they're seeing that up to 40% of people in the ICU are forming clots in their legs, and they're going to their lungs, where it's affecting the blood flow to their lungs. There's increase in stroke. There's increases in ischemia to the heart, lack of blood flow, which we call heart attacks. If you're only in a hypercoagulable state, as we say, if you have a severe form of the disease. So you won't be having a form of the disease where you're at home with a temperature of 99 and you have a cough every now and then. You're not going to be the one whose inflammatory markers are so high that you have to worry about having blood clots. It's only for those people who need, or have the severe form, and usually, will be under the care of a professional in the hospital, and we will be giving you anticoagulants that thin your blood that prevent that. So as someone who has a mild form or no forms, you should not be concerned with blood clots.
Brilliant, thanks for that. I think we'll open it up, Johnny, not for too long, because I know you probably need to get some well-deserved sleep. So, guys out there, if any of you've got any questions for Johnny, just unmic and then, unmute yourself and just ask away.
I have a question. So hypothetically, if they do open up the country from this lockdown, so for non-work, non-school activities, what's your recommendation for our kids? Like, how do we get them acclimated back into society, or do we even do that? And do we just kind of, yes, go back to work, or maybe potentially take them back to school, but maybe leave them at home for everything else? Like, that's what no one's really addressing, and it's directly affecting our kids.
Yeah, it's I can imagine being a kid and being locked up in the house. But if you are living with your children and you have multiple kids in the house, and it's okay for you guys to do activities as a family because you guys are in the same environment. It's when you add a different environment that could be cause a problem. Mental health is very important. You want to make sure that your kids are still limited to 2 hours of screen time per day. That's what we recommend for adolescents, is less than 2 hours a day. But getting them outside and playing is not an issue. You just have to do it in a contained environment. But I don't know the answer when things are going to resume. What is it, April? And I think school is through June. So I'm not sure if it will resume, but just having your kids do things amongst themselves and being outside is not an issue. You just want to avoid unnecessary contact with individuals. But unfortunately, I don't have the answers to those things, because it would just be a hypothetical guess for me to say school is going to resume May 13th. I'm sorry.
Thanks for that, John. Anybody else got any other questions? I know
I had a couple. Sorry, I had a couple of people text me, so I just want to reiterate. I know you've already answered it, but I'll just go over it again because it's quite an important one. What is the only time you should consider going to the doctors or the ER? What's the only thing in terms of symptoms?
Shortness of breath. Shortness of breath. A cough does not mean you need to go. A fever does not mean you need to go. Now, by all means, if you do have a fever and a cough and you feel not well, it's totally warranted to seek medical attention, and that could be going to the emergency room. They just may send you home because you may not be severe enough. But really, shortness of breath to the point where you are breathing over 20 times per minute, you're puffing and puffing, that little things such as going to the restroom or going to the refrigerator is tough for you, that's when we can offer a service. And if you're tinkering and you think, I'm not quite sure, always err on the side of caution and see a medical professional. I don't want anyone to feel that they can tough it out and have something disastrous happen. So shortness of breath is the main thing that you should be concerned with to seek medical attention. If you are home, you do have symptoms, Tylenol is effective. We don't recommend Advil. Advil has actually been shown to decrease the body's ability to fight its own. So Tylenol is okay. It's safe for anyone who doesn't have any liver conditions. They can take a gram of Tylenol, maximum amount of 4 grams per day. They can do that every 4 hours around the clock. So 3 times a day of 1,000 milligrams, it will suffice. Plenty of fluids. What we're not recommending is things that cause this virus to be aerosolized. So if you're an asthmatic, do not use a nebulizer. A nebulizer will, cause this virus to go into your mouth, spread into the air, and it could very drastically harm all of your loved ones. So anything that's aerosolized, if you have asthma, use your inhaler. Don't use the nebulizer itself. But taking antibiotics, taking these anti-malaria drugs and stuff beforehand has not been shown to be effective, and it's causing more harm. So if you do feel short of breath, come see us. Not me.
So, can I ask something?
Thanks, Johnny.
So for the hydroxychloroquine, you're saying that you're not seeing any effectiveness from it at all?
No. It was a novel theory. It has not been shown. We are no longer giving it to anybody in our hospital. We've been fighting it for 6 weeks, and not one person has shown benefits from it. And really, it causes arrhythmias in the heart. It causes problems to your other organs that need to be at their top game to fight this, because your lungs and your heart will be compromised, and everything else kind of has to step up. So if we're given a medication that just has all these side effects and has not shown to be beneficial, it's not something that we're using anymore.
Got it. Okay. I have 2 family members on it for RA and can't get their scripts refilled. So
yeah,
okay.
That's the other thing, is people who need things are not
And
getting
lupus.
it. So
yeah. I actually have another question real quick, back to the kids. You said something about like them going outside, and you're saying kind of, not that it's okay, but I mean, like, is it reasonable if like my son wants to go to the park and take shots on goal, because he's killing me right now, Steve, you'll appreciate that. And I'm the mean mom. So I told, like, my husband was going to go with him and like supervise him and his friend that they are staying apart and they are wearing masks, but he just is dying to get out. So
yeah,
I mean, what's reasonable?
Avoiding large groups. Again, if he can find a field where he can play soccer and not be in a large group, then of course he should. And I encourage that, because you don't want your kids with more energy than they need.
Right.
But also know that, to organize a game with 3 or 4 of his friends we're just not quite there yet.
Right. Okay. Yeah. He's under the impression Cal State Fullerton would work. So
I grew up playing basketball. I would be going to the park and shooting hoops by myself. Let's put it that way.
Thank you.
Guys, I have a question too. Hi, my name is Nick. That's my son Mateo right here. As far as, first of all, thank you, Dr. John, for everything you're doing for everybody in the community and people that really need you right now. Thank you so much. Our prayers go to you for protection for you and the people next to you too at the hospitals.
Thank you.
I do have a question as far as in like, if you have to go out of the house for work or even go to the supermarket, go shopping, and you got plastic gloves and a mask, what's the story with the gloves? Can you reuse gloves? Can you not reuse gloves? What do you think about that?
So, gloves are a kind of a predicament, because yes, by wearing gloves, you're protecting your hands. But when you wear gloves, you're not as cautious as if you're not wearing gloves. So you touch more things. And those gloves are dirty. So when I put on a glove, the inside of the glove is fine. My hand's nice and clean, but the outside is dirty. So everything that I touch. So if I'm the person that's in the grocery store and I feel that I'm doing my part to prevent things and I have gloves on and I touch 3 broccoli stalks, you can spread that way. So the person without gloves is less likely to touch everything. So me personally, I believe it's better for someone not to wear gloves, that they should, if they want to wear gloves, they should take them off, they can discard them, and they should not reuse them. But if you have your hands and you're touching things, before you get to your car, put some hand sanitizer, wipe your hands, have your mask, take your mask off after you've cleaned them, because now you're incorporating dirty hands to your face. Okay, you always want to stop this touching here. So if you can wash your hands with sanitizer, you get to your car, you take your mask off, right? And then you, I would re-sanitize before touching my steering wheel. That's how you can prevent things. And the masks, what I spoke about earlier, is these masks are only protecting other people. And these masks can be dirty. So if you're fortunate enough that you can get your hands on the N95, I'm not sure where people can get them. This is really what's going to say 95% of the time this is going to help you. But if you cover a mask with this, now this is a dirty one, I can discard and reuse this one. Does that answer your question?
Yes, thank you very much. Thank you.
Hello?
Johnny,
Yes, go ahead. Go ahead.
someone asking a question?
Yep.
Yes, I just wanted to ask, well, first of all, I just want to say thanks to Dr. Sanguedolce. I'm sure he's extremely busy right now, so we all really, really appreciate this. It's been very helpful. I just wanted to ask, I was asking in the chat about the GoFundMe page, how any way I can help, or any of us can help to, either give you and your healthcare coworkers more gear or anything, we can do to help you and help allow you to keep giving us these speeches if possible. Because, it's so hard on the news and everything like that. That's all we really have. So being able to talk directly to you and get your firsthand experience on it has just been extremely helpful. So I want to thank you for that.
Yeah, you're welcome. Yeah, so they mentioned that there is a GoFundMe that we are trying to, get raise some money so that way we can, do our part in the hospital. We do have, I believe, over 40 residents in our hospital. We are working, 12, 14-hour shifts, and we do have shortages as far as the grocery stores and getting food and things like that delivered, because there, a lot of people have moved outside of New York City and come and stayed in their homes in the Hamptons. So we are, for an off season, a little busy. So, and if, if that link, you can, anything would help, whether you can buy someone coffee for a day or whatever it may be. It's not a matter of us not having, a paycheck to go buy these goods. It's just the fact that we're always at work and not able to make it to the grocery store. So being able to order in food for all of us and things like that is what we're all trying to do for our part. So I'm not sure Jordan's the face of this, so maybe
I could speak on behalf of that if you'd like.
Yeah.
Cool. So obviously, Dr. John is my brother, and hearing the stories is crazy. And as everyone knows, in California, you couldn't get toilet paper and everything for a while. Well, in New York, their grocery stores are still completely empty. It's not like California; they're not getting the supplies there. However, in going to New York and where he is in the Hamptons, people actually bought 3 or 4 freezers and filled up their supplies with food. So I know half of the people have all these groceries that are going to expire. And unfortunately, like he said, when the shift is over, they can't even get groceries. So I started this GoFundMe that can support the hospital, and they can, as a chief, he can order food for all the hospital and get everyone fed, because we all know how nasty hospital food is, and there's a short supply on that too. Hopefully that answered your question, iPhone. I don't know who you are, but
I have a question.
Yes, it did. Thank you.
Thank you, Johnny. My cousin Johnny, everybody. Love you. We're so proud of you, and we are very thankful. I know I speak for everybody. Wanted to ask you, how are you holding up? This has got to be exhausting. How are you holding up?
I'm good, Luke. Thanks for asking. We've we've been fighting this for 6 weeks, and the last 6 weeks I've been in the hospital with very limited days off. Now we've kind of gathered all of our resources as far as physicians. We have an all hands on deck type approach now, to where we are now doing a 6 straight days off, to allow for some physicians to get some much needed rest for those 6 days. It's nonstop all day, every day. And then you get a little bit of a reprieve. So, coming in the, next couple of days, I'll be able to take advantage of that, so we're always throwing fresh bodies. As far as, mentally, it's been an interesting time, because as a physician, you're used to helping people, and you're used to having good outcomes, and you're used to assuring loved ones that you're capable of helping them and that they're going to come home to you. So it's been really tough to switch your mindset that you can only look at it as from the positive standpoint. As far as, if I have 10 critical patients, I have to now be grateful if I'm able to save one of them, as in the past where I'm used to sending all of them home. So just changing your mindset has really helped me get through this. But there's a lot of people who dreamed of being in this position, who have dreamed of helping others and are able to do that. So it's very encouraging to see the compassion that people have for helping others, and it's something that's pretty amazing to be part of. So I'm just trying to do my part.
Cheers, thanks. Anybody else got any other questions?
Well, last one from me, Rob, and then I'll leave it to you. And before I leave it to Rob, Johnny, just thanks again for everything. You've been on 4 or 5 times now. It's fantastic, and you're coming with more and more information every time. So you're actually going away and researching the answers we don't know. So I really appreciate that you're actually taking the time away from this, away from your job, to actually add to it as well. Last one, and I think it's just going to piggyback on what you just answered. Someone was asking, are the doctors and nurses, are you guys actually receiving emotional support with all the stuff that you're going through? Is there any programs actually in place?
Yeah, there are programs in place that people may need. We're very quick to allow people time off. At the first site, I've had multiple colleagues who have come in and have, I've sent home because they've called loved ones and said that they're going to be okay, they're going to be discharged, and of course something took a turn for the worse. So it has been tough on people psychologically. We have each other's back in the hospital, but everyone has their limit, and we do have resources available for people who need help, because now is not the time for anyone to toughen anything out, because myself as a provider, the moment I feel symptoms, I'm actually more harmful to others. The moment that I'm not my sharpest, I'm harmful to others. So we're all trying our best to, kind of limit our heroics and really listen to our own health and seek out help if needed.
Brilliant.
I have a question.
But I'm okay, everyone. Don't worry. I'm okay.
Nicole, do you have a question?
Yes. How do we know if we had the virus even though we had no symptoms?
That's a great question. So that's why when we get this antibody test, that when you go to the doctors and they draw the blood, they can say, hey, you had this virus and you're already immune to it. But we need more research to say that this is a definitive and great test. So hopefully, that's the case, that everyone has cleared this or has immunity to it without affecting your loved ones.
Okay, thank you.
You're welcome.
Thanks for that. I think we'll try and wrap it up pretty much now. Anybody got any other questions for John?
I see recommend zinc or any supplement. So we've been giving zinc in the hospital, has not been shown to be effective. We've been trying zinc for 4 days. We've been trying vitamin C at a high level for 4 days. We've been trying thiamine for 4 days, and we have not shown any benefit. I did read some studies that people with low vitamin D have been more susceptible to not fight this off as much. It's a preliminary report, and I don't want to put my name to vitamin D as the cure for coronavirus, but it is something that can be monitored. So somebody who has been staying inside a lot and not having much sun exposure, that 1,000 or 2,000 a day vitamin D supplementation, especially for women, can be something that you can look into. Again, I do not know your blood work. I do not know your blood levels. This isn't a doctor visit where I'm saying everyone go get vitamin D, but it has been shown to be effective in helping people's immune system. So maybe if you're able to reach out to your provider and he says, hey, your vitamin D, 6 months ago was completely normal, then he can advise you to take a low end of a vitamin D supplement and vice versa. But that's the only thing we've seen thus far.
Thanks for that, Johnny. So plenty of sunbathing. Okay, gotcha.
And then another one are people with asthma at a higher risk. Possibly that people with lung conditions, sounds that in theory that if you have weaker lungs and you get this virus, that you're worse off. Now it causes a bilateral pneumonia, which is fluid where in your lungs that doesn't allow for oxygen to exchange. So I have not in my experience seen people with COPD and asthma get a more severe form than others. It's really, in my experience, high sugar and high blood pressure that has caused more of a risk for people. But if you do have asthma, stay up on your medications, use your albuterol inhaler, not your nebulizers, and avoid things that can cause exacerbations, because you want to be at your optimal health at all times in the event that you were to contract this.
John, I got one more question. Are you doing any kind of like updates through a channel or something often, or is this just a one-time thing that you're doing?
This is a one-time thing. My brother had asked me to address some parents 2 or 3 weeks ago. I saw the benefit that, people had insightful questions and were eager to learn. I guess I totally didn't screw it up. They asked me to do it again, and this is my fourth or fifth talk. I just, again, I don't want to see what I'm seeing here. I don't want to occur to people that I know and love back home. So this has been our only platform to kind of spread the message and know that, not everything is about what you see on the news, and there's not truth to everything, and that, we're still fighting this. Should I start a TV channel? Is that what you're saying? Is this my ticket?
And it's just really cool to hear from someone that is actually going through it and is on the front lines, I mean, you're right there. So this is excellent. I really appreciate you taking time out of your super busy, 6 weeks, like you said, and, just sharing this information that to all of us is real. So thank you.
You're welcome.
Brilliant. Thank you. I think if we don't have any other questions, Johnny, we'll let you go. I think for all the parents, we obviously appreciate everything you've been doing and your time. And if you're not too tired, maybe in a week, we could have another update. I know the local school district up our way wants to get you involved with doing another meeting. So we don't want to kill you because you've got other things to do. But yeah, from the bottom of our hearts, thanks for everything you've been doing. Really appreciate your insight with everything, because yeah, as many families say, what we hear on the news definitely isn't something that you guys have been saying. So it's really good to hear. And then what I'll do, parents, for the GoFundMe page, all of your coaches, they've been given the link, and I'll send it to them again. So just ask your soccer coach, whoever you're playing with, to get the link directly. I'll also send it out. So there we go. And then if any of you wanted to hear this again, I can email this out because we recorded it. So if anybody didn't get to jump on this call, we can send it out. So there we go. Jordan, Steve, you got anything?
No, do you mind staying on a little longer, Johnny, just in case people weren't comfortable asking questions in front of over 150 people? Just if you could answer a couple questions, or
sure.
And then, like I said before, Johnny, thank you for everything. I'm going to go out, get my son, get a bunch of boys, head down the park now, kick a ball around. Sorry, just me and my son only in the backyard. So I appreciate everything, Johnny, and I look forward to seeing you again soon. I think you're going to do one with all the El Dorado programs, I think.
Well, I did a talk with soccer and basketball at El Dorado already, but the handsome guy with the mustache is my agent, so speak to him.
He's your agent to deal with it.
I don't know my schedule. I don't know. He tells me when.
Appreciate
it, Johnny.
He wants to get on a call with a couple thousand people, so we're planning that. So, and then he'll be on CNN at following after that.
All right, let people ask questions. No more of your stupid jokes.
So okay, yeah. So if anybody wants to stay on, you can. If not, thanks for everybody for joining, and we'll talk to you soon. There'll be some more updates. I know myself and Steve are going to put together a college Zoom meeting for some of the older players. So we'll be sending out details about that. So from everybody here at Strikers, stay safe, stay healthy, and look after yourself, and we'll talk to you soon.
Bye, everybody.
Round of applause for Coach John, Dr. John.
Sorry, guys.
Brilliant. Thanks, John, for that.
Well done, sir.
Who's got questions?
We'll see if anybody else.
Yeah, I saw one right here. I work in a nursing home. What should I do for the best safety for myself as a mother?
Works at a nursing home?
Yes.
Yeah, so the question is what she can do to prevent spreading it at the nursing home. Is that right?
Yeah, I work in a nursing home. What should I do for the best safety for myself as a mother?
Well, if possible, you should be wearing an N95 in any healthcare facility. That's this mask, and you should be wearing another mask on top of it to protect it at all times. And I recommend having a routine that you get your car, and whether that be having a change of clothes because you can't stand your clothes, taking your shoes off before coming into your house, washing your hands first thing that you do when you come in. So to protect yourself and others, wear a mask at work. I have a routine where I take my clothes off outside and walk into my house and then grab them and wash them with hot water and soap after. So those are the things that you can do.
The questions are flying. See, Rob, have you seen any that I missed? Are cancer survivors considered? I can't see it anymore.
Compromised immune.
Are cancer survivors considered compromised immune? There it is.
Cancer in and of itself does not mean you have an. If you are currently being treated with like radiation or chemo, then you have more of a higher risk. But again, I'm not sure what the literature says for anytime you have an average adult or young adolescent versus somebody with chronic conditions, it doesn't fare well. But again, I keep reiterating that it is not so much from my experience from the 150 or to 200 patients that I've actively touched and treated, that really high blood pressure, heart disease, and high sugar has been the worst for severe disease and fatality.
Thank you.
Dr. John, what is your name of your hospital? I'll be shipping 2,000 N95 masks by the end of the month to the New York hospital. I hope I could add your hospital to the list. I work for a clothing company and we are making PPE, washable masks, and gowns.
Oh, that's fantastic. Thank you. Thank you for doing that and doing your part. I work at Stony Brook Southampton Hospital in Southampton, New York. So Stony Brook Southampton Hospital. Southampton being one word. And thank you for that. The number to the hospital, that you can get in contact with someone who can take on something like this. I don't know the logistics, but would be 631-726-8200. Again, 631-726-8200.
What can we do to help the elderly people but still want to stay safe?
Avoid them or wear masks around them. My grandmother is almost 90 years old, and my parents have been visiting her via they'll go in the garage and they'll be 10, 12 feet away or just be outside on her porch while and they'll talk through a window. Unfortunately that they just don't have what it takes to fight this, and if it means they have to sit out one Easter to have another 5 or 6 with their grandchildren, then that's what needs to occur. So just avoidance, unfortunately, a lot of FaceTime and sending your love to them, knowing that you're not just neglecting them. Thank you again. Hope you guys learned something and take this with you, and have a good night. Thank you.
Brilliant. Thanks ever so much, Johnny.
Yeah, Johnny.